patient had a year of history of back pain and radiculopathy, which corresponded to the L3 to S1. Conservative therapy failed. I just finished his surgery. The 3-level fusion, L3 to S1 with 3 cage, 8 screws, and 2 rods took us about an hour, actually less, 58 minutes. And our blood loss was half a cup of coffee or about 164 cc. It is very accurate because we measured the sponges dry and wet. And these are the actual, this is the finals, but I'm going to show you the actual steps of the surgery. A patient had a BMI of 42, so it's a little on the higher side of the BMI. And as you see, you don't see the disc base because patient has a scoliosis, so not all the disc bases can be visualized in the same cut. Just by positioning, most of the scoliosis is actually corrected because have to make sure with the fusion stays that way. So we adjust first for the L5S1. You see the alar line that they are going to be adjusted. And here you see that we perform the measurement on the skin. This wire is on the skin. Once we have the trajectory, first we put a Jamshidi in the right pedicle, get bone marrow that we mix with our biologic. We use tricalcium phosphate. Then under neurophysiological monitoring with 3 milliamp stimulation, we approach the Cambin triangle, and then we are able to pass a K-wire and then a dilator. Look at how the dilator opens up the space. Here you see that it lifts it up, and as well air it gets sucked in, and then we perform a discectomy. As you see, there's a series of tools that help us to do a discectomy. In this case, really no discectomy or major discectomy needed to be done because there is practically no disc. Here, the K-wire is reinserted and the transcambin OLLIF cage is entered, and then we, at this point, since we are set up for L4-5, we put the screws, or actually Jamshidi, in the L5 and S1. So here you see the K-wires are inserted. Then we go pay attention to L4-5. If you remember, it was really hard to see, but now we have adjusted it and we see a barely end plates. There's really no disc left there. So after we adjust it here, we go again with 3 milliamp stimulation inside of the disc base, and pay attention first of all that we are adjusting the trajectory. There is a little bit of an angle between K-wire and dilator. We adjust for that and we enter it. Then we go all the way across and you see air get sucked in again. Then we perform a discectomy and pack it with tricalcium phosphate soaked with bone marrow, and then cage is going in. Just to be clear, it is just 15 minutes or 20 minutes into the surgery where the second cage is inserted. As a matter of fact, as you see here, the time we position the patient is 12:46. The time we put the Jamshidi, so first cut, is 12:52, and here the second cage is inserted already by 1:11, so about 22 minutes later. Now, Jamshidi and K-wires are placed in the L4, and here you see the same in the frontal and the AP view. Then we, in the same fashion, you see the spondylolisthesis in the L3-4 here. Now we enter it, dilate it, look at how it changes the parameter by opening up the space. Here the same, you see how it lifting up, and that action we call anatomic physiologic decompression that truly open up the space. This patient wake up and the leg pain is gone. I have over 1,000 patient testimonials that tell us that the leg pain was gone as soon as they woke up, and claudication symptoms will go very fast away right after they wake up. Here we put another cage again, and here then at this point we just put 2 more K-wires, and obviously in the lateral view, you see the surgery goes on. At this point, the AP machine is taken out. That's all we are going to see now is the lateral view. We put the screws in the L3, and then we use a device we call decorticator that roughens the surface of the facet. We pack the space with tricalcium phosphate. Then all the screws are going in. And as you see here, the last screw is placed just about 40 minutes after first cut was performed. Now the rod goes in. And at this point, practice surgery is done. This is the final. We put a epidural steroid injection for postoperative pain management. The pain management is very deliberate here. And then these are the finals. So about 50 minutes, less than 50 minutes after first incision was done, surgery is done. The rest, the next 8 minutes we spent with closing the skin. And here is the skin incision of this patient. The L4-5 is entered. L5-S1 screws are entered through this. The L4 and L3, and here's where the rod passed through. And incision here is the one that the cage, all three of them are inserted.